My mom is such an integral part of our family. She really is the figurehead at the top, and my kids are so close to her, and I couldn't imagine having this conversation. So it's really, medical isotopes really do give us hope. I mean, without that, we wouldn't have found out she had breast cancer if we hadn't done the scan. And if we hadn't figured that out, it would have been awful, I think. I really do.
Tell us a bit about your mom.
My mom's a warrior. She is strong and kind, and she really is just somebody that I really look up to. It's easy to talk about my mom. My name is Karen Stevenson. I'm the Director of Research and Education Support for McMaster University's Nuclear Operations and Facilities. It really had an impact in our whole family's life as she was diagnosed with stage 2 melanoma. And when sitting with the doctor there as he's giving us this awful news, I said, "Are you not going to do a PET scan," which is a positron emission tomography scan that looks for cancer in the body. And I knew because of my background that it would be effective with melanoma. And lo and behold, we discovered she actually had a secondary cancer, not related. She had breast cancer as well as having melanoma at the same time. And we caught it early. It was stage 1. It was an aggressive cancer, and I really believe it probably saved her life.
An estimated 1 in 24 people in our country were living with or were survivors of cancer.
The World Health Organization says cancer cases are on the rise around the world, and medical professionals in Canada are seeing it firsthand.
In 2022, there were nearly 20 million new cancer cases worldwide. The World Health Organization estimates that this figure will rise to 35 million by 2050. That's an increase of over 77% in less than 30 years. Today, it's estimated about 1 in 5 people will develop cancer at some point in their life.
To help fight cancer, doctors need a key component: medical isotopes.
Medical isotopes have been described as the cornerstone of nuclear medicine. For decades, these tiny radioactive particles produced in places like the McMaster nuclear reactor have been used to diagnose a wide range of diseases. And thanks to recent developments in the field of nuclear medicine, they're also used to provide patients with targeted cancer treatments. But what are medical isotopes, and how do they work?
Oh! The funny thing is when you hear about medical isotope, it sounds like magic, but nuclear medicine enables a different way of seeing inside of people, and it really is able to localize where a specific disease is and allow us to treat those diseases. My name is Erica Dow, and I work in Nuclear Operations and Facilities as the Manager of Nuclear Outreach and Education. There are 2 main types of medical isotopes. The first are diagnostic isotopes, which we use to get different images of the inside of a person's body. The second type is a therapeutic isotope, which delivers energy and radiation in order to kill a specific target, most commonly cancer cells.
When these radioactive atoms are added to certain chemical compounds, they become a radiopharmaceutical. That's a radioactive substance that allows the isotopes to be safely administered to a patient and travel throughout their body. Once inside the body, a diagnostic isotope acts like a beacon, emitting low levels of radiation to expose the area where disease is present. Using specialized imaging equipment, doctors create pictures that show where cancer tumors are present. Once the diagnosis is confirmed, the patient can be injected with a radiopharmaceutical that has a therapeutic isotope that travels to the tumor and releases highly targeted blasts of radiation that kill cancer cells while keeping surrounding healthy tissue safe. But before these isotopes can be used to save lives, they have to be created. And all of that starts with nuclear science.
For more than 6 decades, it's been processing and distributing medical isotopes for the treatment of roughly 70,000 cancer patients every year, both at home and abroad.
Most people that hear about nuclear medicine have probably heard about it in the last 10 years, maybe last 20 years, but McMaster's been doing it for almost 70 years.
McMaster is really special in this field because we have a research reactor We have a cyclotron. We have this high-level lab facility that allows us to go from core to clinic. What it means is it gives us near universal isotope production capabilities. So when you can be foundational in that research, it really allows us to think broadly and brightly about what might be from those isotopes.
Since the 1950s, McMaster has been such an innovator in the nuclear medicine space that momentum has really carried us in order to build that global impact.
The field of radiopharmaceuticals is in the middle of a renaissance, a revolution, however you want to say it, but the future is really bright. I think there's going to be new treatment options for cancers that we had nothing. And I think some of our sickest patients are going to have hope.
Can I ask you hope for what?
Hope for longevity, for more time.
Ever since I was a kid, I always knew that I wanted to dedicate my life to helping people in some sort of way. Cancer is a type of disease that doesn't discriminate between people. Anyone can get cancer. So it's so meaningful to work in nuclear medicine because you can help millions of people that have that type of cancer.
So when my mom was diagnosed with cancer, and then I found out she had melanoma, and I had worked in melanoma research around radiopharmaceuticals for just a little bit. I knew enough to kind of be dangerous, but I'm not a physician. And so I was worried in a very deep way, certainly mad that this was happening. And I knew when we had the staging and when we had seen the doctors and he'd said, okay, there's this, and the margins are clear and the lymph nodes are clear, I knew we were going to be okay. I am a scientist through and through, but I do believe that sometimes things are just aligned and you're supposed to get the information when you get it, however that is. Yeah. Mm-hmm. Yeah, because you just never know.